All righty, greetings everyone. Welcome to the May 23rd CPS Board of Education Health and Safety Committee meeting. I'm going to take a quick roll call to see who is here today. I know that I am here as the Chair of Health and Safety. I'm going to call next for Vice President Jones.
Here.
And Board Member Moffitt is not here. Hopefully she will arrive here shortly. Unfortunately, today we are recording this due to not having the capabilities of having those of you in the community watching virtually. So you can definitely check into the board documents at a later time after watching this. And members of the public who wish to speak who are here today, I think we have one person. If we have anyone else, you can sign in. I'm going to go ahead and get started with our agenda. It's going to be a quick meeting today. I would like to first start off with Women Helping Women. We have Nicole Mora and, excuse me if I'm saying the name incorrectly, Frazee Katz. Thank you so much. They're going to come up and they're going to present. So ladies, hopefully you have your information with you. There's a little speaker button there. It'll turn red. I think he's going to turn it on for you here shortly. Thank you so much for coming. Nice to see you as well. All right.
There we go. Perfect. Good afternoon. My name is Nicole Mora. I am Chief Strategy Officer at Women Helping Women. With me is Frazee Katz, who's our Advocacy and Policy Director. Really wonderful to be joining you in space today. We've had the opportunity to connect with Chair Weinberg and Board Member Moffitt to share a little bit about our prevention work in CPS, but wanted to ground us in some of the information, some of the work that we've been able to do, and the urgency for prevention in CPS right now. So the last 2 years were the deadliest on record for domestic violence homicides of women in Hamilton County. We went from 4 to 20. Women Helping Women works to prevent gender-based violence and support all survivors, and a key part of that is our prevention work. So as recently as March, we saw a 17-year-old girl killed by her ex-boyfriend, leaving behind an infant daughter. And unfortunately, that's reflective of the trend that we're seeing, where domestic violence incidents are skewing younger and younger. They're largely affecting women, largely affecting Black women. Women Helping Women has a nationally recognized program called Divert that goes out on scene with law enforcement in response to domestic violence calls. And through those interactions, we know that 79% of those responses are women that have children present. Locally, our highest response rates are in CPD districts 3 and 5. So we know that this is the CPS footprint. The communities, the overlapping communities that we're talking about here are specifically Euler, Western Hills, Dater, Gamble, Aiken, and Hughes. So the stats are there. 1 in 3 young people experience teen dating violence. 1 in 5, ages 11 to 14, say their friends are victims of dating violence. And 2 in 5 of our youngest tweens, 11 and 12-year-olds, report that their friends are victims of verbal abuse and abuse in relationships. So I mentioned we do have some presence in CPS. I'm going to invite Casey up to talk a little bit about our current work and where we are providing our programming and some of the outcomes that we're being able to see already.
Thank you so much, and thank you so much for allowing us to speak about this program. As Nicole said, my name is Frazee Katz. I'm our Director of Advocacy and Policy, so I oversee our school-based programming. And in this past year, we've worked with several CPS schools. We just want to increase that footprint. As Nicole was talking about with our Divert program, our goal is to try to move towards more of a prevention angle so that we're seeing students in schools first. We're talking about these issues, we're helping them work through, giving them skills, so that then we're not seeing them at 3 in the morning when police have to arrive. So in this past year, we've worked with several CPS schools, including Clark, Gamble, Dater. We'll be working with SCPA this summer, Withrow, Aiken this spring, and also Hughes. We have been reaching out to principals to try to set up additional meetings so that we can work with schools, again, specifically in that area where we're seeing rates are higher. We're wanting to get more prevention material there. And what we're seeing is that when we're in schools, our educators are really connecting with students, and students seem to be really hungry for this material. They're ready with questions, they're ready with experiences, they want to talk about what they've seen and ask questions because they're seeing things. One of the examples that comes to my mind is an educator said a student was telling her after the program, she knew something was wrong in her friend's relationship. It seemed odd. And as she went through the program, realized that's what an unhealthy relationship looks like that's tagged as abuse. And that felt like a light bulb moment for her. So in terms of outcomes, what we see is that over 90% of students we're working with feel confident about setting boundaries with a dating partner after the program. The program is based around an evidence-based program called Safe Dates. So it focuses on dating relationships, but the material and the skills expand to all types of relationships. That could be with their parents, with their siblings, with their peers. We're also seeing peer-based violence increase as well. So those skills are transferable. And then we're also seeing about 96% of CPS students specifically in this last year were able to identify signs of a healthy relationship after the program. And about 90% felt confident about their ability to differentiate between someone giving consent and not giving consent. We talk about that blurry boundary sometimes that students can experience, how they can set boundaries, whether that's physically, whether that's digitally, what they're seeing on social media, or maybe partners who are trying to ask them for passwords to their things like that. And then about 82% of students felt confident to intervene when someone was being bullied. A component of the program includes bystander intervention, empowering students with education and skills and abilities to intervene, which is a broader word. That could be personally, that could also be getting a security officer or a teacher or sharing that material with maybe a safe adult. At this point, I'll turn this back over to Nicole.
So we see the stats, we see the trends, and this is where we're stepping up as a community partner to say that we have skilled educators, we have evidence-based curriculum, we have the funding to provide this and go to scale at all CPS schools, 7th through 12th grade, so that we can really work on prevention. And as Casey said, meet students in the classroom and not at 3 a.m. in response to violence. We've been having really great conversations. Ms. Murphy has connected with me after the board assignment last month, and being able to get over a proposal of how we scale. We've had relationships, those one-on-one interactions with schools, but really wanting to be strategic. We have the support of the Hamilton County Board of Commissioners. Recently, they approved the resolution to scale prevention programming across Hamilton County, beginning with CPS as the largest district. So Commissioner Driehaus is a big advocate. I believe we have a meeting set up with our new superintendent, Wright, coming up in June. And so we really want to grow on our current partnership and, again, be strategic in the way that we move forward with a goal, 100% of 7th through 12th grades over 5 years. We sent over a proposal of how that can look so we can be really mindful of hitting those grades in an intentional way. And working with partners who are present and have similar programs. One of the conversations we had recently at Riverview East has a person dedicated through the Margaret's Place of providing counseling around some of these topics, and she was thrilled that there could be an opportunity to increase her capacity. As one person, she can't provide all of this to every student, and so this would only support her work, and so we are also ready to provide funding and support for organizations that are doing similar work. We just want to do the work and make sure that students feel safe in school and out of school.
Thank you. Thank you so much for providing us with information regarding your program. I have two comments, or actually I have two questions, and then I'll open it up to see if anyone does have any questions. But when you're pulling or getting the data from the individual schools that you're working with at CPS, what measures are you using to get the data of showing how effective the program has been?
Sure. So currently we use SurveyMonkey. We provide the link to the teachers to get to the students, and they enter pre and post data, how they felt related to their skills and confidence before the program and after, and then, excuse me, also any strengths they found or things they particularly learned from the program, and then maybe any challenges they had.
And can you just go into a little detail of, quick detail of how long is the program? And I know that you stated that you do a follow-up, but what would be the, I guess, besides the survey, is there any additional follow-up?
Besides the survey, there isn't necessarily any individual follow-up other than ideally, the program tends to work best when we can continue working with a school year over year. What we see in the outcomes for schools where we've consistently worked with them year over year is that those outcomes continue to increase. And to answer your first question, the program itself, I'd say traditional model is that it's offered Monday through Friday in a given class. Typically that's a health class. So if there are 4 sections of a health class each day, then we would be in all of those sections. Some schools recently, when we were with Hughes, they wanted to be able to have more students participate, and so we were in a history class. I think there were 6 periods each day, so that allowed us to be able to reach more students. But that's traditional model.
I will open it up to other board members or anyone else. Yep.
You have to forgive me, I'm not quite sure in my head what my question is, so I'm going to be pretty blunt and just ask what's coming there. So I heard Nicole say your interest is in scaling up, so you want to scale services up in the district. Is this, are there funding implications around this?
Women Helping Women has the funding to provide this in full. We're not asking for any funding from CPS.
Okay, so no funding, but I would imagine if you're expanding to other schools, there is some kind of what we call in-kind. I mean, you would want to work with the district around certain accommodations or time or whatever. Is that true? Is that pretty much?
So all we ask for is access. Yep, okay. That's all. So we have the funding, we have the curriculum, we have the educators. We just need access, strategic access. The one-on-one approach has been working okay enough to get into some classrooms, but because of the urgency with the support of the commission again, we really see this as a need, and we need to scale in a really thoughtful way. So no fund. I know that's not an often a request probably that you get, but no funding asked on our behalf. We have all the resources that we need, and so then it's just coordinating, communicating that out to leadership at schools, recommending. One of the other pieces of this is that, so there's House Bill 19, also known as the Tina Croucher Act, that requires teen dating violence prevention programming in all 7th through 12th grades. And so that's the piece that we want to come in and be able to do that in fidelity. And so that's all we want is just the access.
Okay. Thank you. And then my last question is, this isn't going to, I don't know if this is going to come out right, but is this your first ask is to the committee? Have you had any preliminary conversations with administration?
So last fall, this is prior to my tenure at Women Helping Women, but there were some conversations with interim superintendent, with Ms. Murphy, very supportive, connected us to resource coordinators. We presented to resource coordinators in February of last year, or this year, excuse me. And we're able to get a little bit of traction in schools there. So we lined up Withrow Hughes. We finished out a curriculum in Aiken this year. Casey mentioned we're going to CPS in this summer. So that worked, that initial support of going to schools. I think it's now taking it a scale up, right, and really working with leadership, really thinking about how systemically we're able to implement this.
Thank you.
All right. Anyone else? Thank you so much.
Thank you.
All right, we are going to move on, I think, to discussing May is Mental Health Awareness Month, and we have Susan Shelton, who will be presenting from MindPeace. How are you?
Hi, good. I'm Susan Shelton, and it's so nice to be here. Thank you very much. MindPeace has been a longtime partner of Cincinnati Public Schools since we started as a nonprofit in 2008, and CPS was our first school district partner and our best school district partner since then. Our role is that we lead the school-based mental health network for all the mental health partnerships in the school. I'm so glad that you all are giving some priority to this month, and it's being Mental Health Awareness Month. The mission of MindPeace is really to build a whole system of care for Greater Cincinnati, and mental health is a huge component of that, because we kind of imagine with the, because of the community learning centers and the way that you all embrace engaging the community at CPS, it really led to a change in the delivery of mental health services in Cincinnati. And it really was a tipping point for change there. So that's our mission, and a lot of our work is around school-based mental health partnerships. And I don't know how to change the slide, sorry. Oh, thanks. So you guys, I'm a terrible graphic artist, and I love bubbles, so I apologize. But this is the network for CPS for school-based mental health. And all those little bubbles around the circle are all the mental health partners that are committed to community learning center values, to the values of school-based mental health. And the Hamilton County Mental Health and Recovery Services Board is also very involved, as is CPS, obviously. And then in the center is the school. Each school, which is a community learning center, has its own mental health partner that they've chosen based on the needs of the community for that school. And MindPeace facilitates that process and then provides technical assistance. So these are just very briefly, just so you know, the principles of the network. All the partners, which is an open network, but all the partners agree that they will strive to follow these goals and philosophies. And it was established by the community itself in the very beginning of MindPeace. So this isn't something that MindPeace said had to happen. It's CPS and many other community leaders and neighborhoods themselves and so on. So as a network, you know, our goal is that therapists are co-located, full-time, integrated and aligned with the goals of each community learning center, that the partner is accountable to what, you know, the community really wants, and that there's a continuum of services. It may not be that the mental health partner provides all those services, but they're involved and they provide expertise and guidance. Right now, we've always been working to improve parent engagement, improve the safety net, so when kids unfortunately die of suicide, that we understand how to respond afterwards in a way that's evidence-based so that we don't have contagion, that we try to keep suicides from happening, so we do a lot of work in that area, and we improve transitions in care, because we find a lot of kids in mental health treatment, when they transition, like say from elementary school to high school or high school afterwards to whatever they're doing, they're at risk of falling out of care. And so those are some areas that we work. And I was looking at Carolyn because she actually started that work in Cincinnati, transitions in care. So, next slide. And then just so you know, we collect data for the whole network, and each school or community learning center receives a report every year around what's happened with the mental health partner and the treatment. And it's all data that was agreed to be collected by the partners and the community. Each partner itself is also required to provide quality measures on the quality of their services. So they use their own evidence-based treatment models, and they use quality measurements to do that. Unfortunately, in Ohio, we don't have a standard for quality measures per se. There's just a list of evidence-based approaches. So, next slide. As far as, so we have data that'll be coming up for the 21-22 school year, but we have 61 schools that are in CPS that have partners. We measure prevention services. So these are services typically by the partners that are not paid for by anyone. It's value added. They're there full time in the school, and so while they're there, they do other things just to help. They consult with teachers. They come to meetings at the school site to help with, like say, your MTS system or PBIS or some of the other things that you're doing. They're just part of your team. Next slide. And then as far as treatment services, so the 2021 school year, in the midst of the pandemic, still about 2,500 students were able to access treatment. And this was an access percentage of 72% of referrals that were made for students who needed mental health treatments received them. Just to give you an idea, in a normal year, a non-pandemic year, only about 25 to 50% of kids get access to care in this country. And at CPS, it's not good enough, but 72%. Our benchmark is 80% based on the School Health Index, and we're the only network of its kind in the country. And people come here to see the work we're doing because it's not acceptable, but it's really good compared to the nation. So 72% in a pandemic year, I was like, oh my gosh. And it just speaks to the work and the collaboration that happens at the school site with all the school people, the teachers, the principals, the social workers, everybody and the mental health partner working together to identify kids who need services and then who get them connected to care with their parents' consent always. Go ahead. Thanks. Unprecedented. So we have an unprecedented mental health need right now. It's really pretty unbelievable. Suicide, second leading cause of death for high school age kids. Nearly 1 in 3 parents shared that children's emotional health is worse than before the pandemic. Half of all mental health issues present before age 14, and yet most kids don't get services. That number, 25 to 50%, get access to care. And then mental health ER visits went up over the pandemic and afterwards, 24% for 5 to 11 and 31% to 12 to 17. And then 1/3 of high school students report these feelings of hopelessness. And that's really, when I think about mental health and with kids, it's the feeling of hopelessness that really is the issue that underlies everything. And so we have at CPS, we have the cumulative effects of the pandemic. We have grief and loss, a lot of grief and loss, and a lot of trauma. And then we have stress on the mental health system itself, but at least we have a system in Cincinnati. I always say we're bailing water this year, but we had a boat. In a lot of places around the country, there was no boat. We also have a therapist workforce crisis. It's across the country, it's in the state, it's here in Cincinnati. And we have a system that we've been working to try to fix that. And then we had 2 schools, Withrow High School and Midway this year, that had a transition of partnerships. So that was very difficult for those two schools and their kids and families. And then some of the mental health teams this year got to capacity. So, next slide. So we responded. We have this network. This is how we responded. First of all, so all schools now except AWL and Taft High School have a lead school-based mental health partner. A lot of these partnerships have been in place for a while too, which is good. And AWL and Taft are going through the process to choose a new partner. We established a referral system to MindPeace for the teams that got to capacity and the teams, those two teams that had no mental health partner, because MindPeace has the database of all the mental health therapists in Greater Cincinnati. So what would happen is we had an official request that would come to MindPeace. My staff would be notified. We'd call with the permission of the parent and say, exactly what do you need? What's your insurance? Do you have transportation barriers? How do you get, and then we would go and find appointments for the child. Or if they couldn't, like I had a family in North Avondale, they had no transportation, but they really services. So we would find one by one, every family, try to get connected to care. So we set that system up, and that system went well, knock on wood, or my daughter would say knock on wood. Then we had deep collaboration with the social services team, like your social workers, the school psychologists, the assistant principals and principals, just to get, how do we find kids care? How do we make sure that the safety net is placed? We also connected to lots of other resources around grief and loss, suicide prevention, trauma care. And then CPS is also part of a quality improvement initiative with hospital transitions. Only one of 5 districts that is on that team, co-led by MindPeace and Cincinnati Children's. And then we have big advocacy efforts around workforce retention for those therapists and attracting therapists. And we have educational efforts around the mental health financial system to change this whole workforce issue long term. So all of that has been going on this year behind the scenes. Next slide. And then the other way is MindPeace rooms. So we discovered about 5 years ago that kids really didn't have a place to calm their brains and then learn how to calm their brains. And I'm an engineer by background. I like process and data. And so we put together a MindPeace room that has places and processes for kids to actually practice calming their brains when they're upset or they've been traumatized or have mental health issues. And so, next slide. So we have 21 CPS schools that have MindPeace rooms. 2 more will be open this month. And like Ethel Taylor is a great example. That principal there, Principal Hedden, she's embraced it so much. It's a preventative thing. Some of the kids are part of their behavior plan. They come to school and they go to the MindPeace room. It takes about 14 to 18 minutes. They calm their brains, practice the skills, and then they're right to class. Or if someone is having an emotional outburst in class, they can come there, calm their brains. They may still go to the ALC, but they'll be calm. We have data that supports all this so that kids can see what they're doing. They sign in and out themselves. And I think it's been really helpful. The staffs have asked for their own MindPeace rooms. So some of the schools we've started turning their staff break room into a calming space. And we have our first 2 at Reese Price and AMI. And we've been funding this in combination. Last year, CPS received some funding that they were able to do. And then we just have gotten grant funding ourselves to help out where we can. And I really believe the kids need to be able to choose and practice calming skills and understand their feelings and then be able to de-escalate themselves, not just at school, but at home. I think that's it. I think I took too long. Sorry, guys. And these are pictures of some of the spaces. They have stations, and everybody goes through the station practicing these skills and so on. And they're high school and elementary and preschool, for different ages. So I think that's everything.
Thank you so much for presenting. I think it's really nice that we have the rooms available for our students and that they're using them. So thank you so much for giving us the information. I'm going to open it up to see if any other board members have any comments or concerns or questions.
Well, of course I do.
Yes. Vice President Jones, go ahead.
Okay. It's good to see you.
Good to see you,
again.
too.
You have 10
Yeah.
seconds, by the way.
We go back, I'm sorry.
You have 10 seconds.
Listen, don't go there. It's nice to, first of all, let me congratulate Mindpiece on the work that it has done over the years. I think you guys have really set a high bar for having mental health supports in the schools. And it is modeled. People talk about it. Like when I go to state meetings and stuff, and everybody says, oh, Cincinnati Public has school-based mental health. And I was like, yeah, we do, you know. So thank you for that. And I remember when it first started and the anxiety, because I was working at the mental health board, and I remember the anxiety around what that plan would look like. And I think that you all have done a great job in adding great value to what's being provided for our kids in the schools. So I have two questions.
Okay.
One is you spoke about the involvement with children around some of the quality improvement stuff. Does that include ways to share data about the specific clients who you're serving in the schools? Is that data on outcomes shared with the district?
So that quality improvement effort is around reduction of kids needing to be hospitalized and that transition back and forth from school and home. And yes, part of that is sharing information. Okay. So how do you share information with the school? Like how does the right person at the school know that a child's in the hospital and are ready to receive them, or when they have to go to the hospital, know that? And then how does the mental health partner, who is also different probably, how do they all work together and share data together about that? So there's a piece of it that's data.
Okay.
And then a big piece is family and making sure that they feel comfortable, because as I always say, having had a child that had to be hospitalized a few times, it's like, it's one transition for the family. It's not a school transition, a hospital transition, a home it's one transition. So there's data part there.
Yeah, my question is more specific around how would the district know, like teachers and their intervention specialists, how would they know that a child is improving?
Yes.
And, you know, things like measuring attendance or grades or anything like behaviors, monitoring behaviors, would they have data to support?
So right now we have data around the treatment itself. So symptoms of depression, symptoms of anxiety, symptoms of, you know, what's measured on the ADHD scale for the Vanderbilt, but as far as like, you know, attendance or behavior, we have not like made the link to be able to report out on it. I would love to be able to do that. That would be amazing if we could do that, because I really believe that we affect attendance for kids who have significant mental health issues, you know, and we affect probably the behavior piece. So
Great.
if we could figure out how to like run a test, I'm looking at this, you know, my fellow, you know, teammates here. If we could figure out how to do a pilot of that, that would be amazing. So we could get that, you know.
Yeah.
Yeah.
And I just have one more question, but I just want to say, I think that would be an excellent sort of exchange. So we could really look at, I mean, not only do we want to know, I mean, I think the district is convinced that we need Mindpiece and the school-based services.
Yeah.
But I think more so, we need to know that our kid, what benefit it has or what impact it has on children's mental health, so that they are able to perform and do their work and,
right.
you know, stay awake in class or whatever that is. So, okay, well,
no, I
that's
agree with
something
you.
for
I
the
think
future.
too that the thing that we always have to watch out for is that we lump everybody into mental
Yes,
health or brain
that's right.
disorders. And you have some kiddos who have very debilitating chronic conditions like bipolar disorder or severe depression or trauma, and the trauma keeps happening. So to me, attendance is the first priority, and reduction of the behaviors, and then giving kids tools so that they can, again, calm their brains.
Sure.
So I really want to follow up on that.
Okay.
And
And then my last question is, when I was in the mental health arena, and you remember that time when Medicaid was elevated to the state so that the mental health board had no
Yes.
oversight? At that time, the billing for mental health services in the schools could only happen for those kids who had Medicaid. Is that still the scenario?
that's still.
So
this-
it's still, so they're.
Oh, for kids who have
Medicaid.
private insurance?
Private, and that's exactly what I'm referencing.
Yeah,
Is that
so-
still a barrier?
It is, so that barrier itself has been eliminated. So with the help of Cincinnati Children's and other partners that are a part of our group, like Best Point or some of the other partners, we've worked out a way to be able to bill private insurance, I don't bill it, but they do, for the financial
good.
model.
Right.
The problem is that the private insurance rate is very low. So it's very difficult for people to pay the salaries based on the private insurance rate.
Gotcha.
So,
Okay, thank you.
Yeah.
Good to know. Thanks.
Thank you for the presentation. I just wanted to add, I think it's important as we hear the conversation around how we're monitoring students and how we're looking at the outcomes for students. One of the conversations that we really are having across the team is around both strategy, systemic approach, and scale. Because one of the things that we have in thinking about how we're providing services right now and thinking about the system of care,
Yeah.
that system of care information resides in a different program outside of where student information systems resides. And so if we are able to identify through our student information system, what students are receiving in terms of services, it will then allow us to look at this is how students are, if there's been a change in attendance, or if there's been a change in behavior as a result of that. So it's a greater conversation to have, but it is possible for it to be done through Power School and for us to start helping with some of that monitoring. So I think it's something for us to really, really talk about as we
Yeah.
move forward.
I'm really interested in that because we work with now 24 school districts across Cincinnati, although CPS is the largest and the best. And the best.
And you said "and the best." I want to
and the
make sure that's
best.
out loud.
Woohoo! And the best. Yeah, I believe that. But we just have to continue to do work around the FERPA and the HIPAA issues, but we have figured out how to do a common referral tracking system so that you all can see all the names of the kids that are referred and if they're in treatment. So separately, there is a way to do this. We just have to spend some time. And so I'd love to meet with you about it. And it'd be fun to meet just to let you kind of get a deeper dive on what's going on and get your insights.
Thank
Thanks,
you.
Superintendent.
I think we have one other comment, Board Member Moffitt.
I do. I just want to say I apologize for being delayed. I had an emergency with my own kids. So please forgive me for missing part of your presentation.
No.
I'm super excited. I got a chance to visit some of these rooms, and the tours immediately stopped because I was playing in the rooms. I was kind of happy. They work. They definitely work. My question was going to be around what Board Member Jones asked regarding some students not being able to get services. I remember when my kids, just a few years ago, were in Withrow, there were students that needed services that couldn't
Yeah.
get them if they didn't happen to be connected to a some sort of medical insurance. So my question was going to be, and you did answer it, so thank you. My question was going to be for students who cannot receive services, is it possible that they could get what the littles get, which is like a mobile mental health kit of some sort? It was like a little cushion, and then they get the little breathing apparatus and the little squeegee thing. You know, is there that capability on a bigger kid level? But it seems like they're able to get some. All of our students can qualify for something, right?
They can get something. And especially with the addition of the school social workers, it's been a game changer, I have to tell you guys. It has been a game changer because we can do these targeted interventions for kids. And sometimes they have mental health help too, but a lot of times they don't. And they're getting groups, they're getting, extra check-ins. I mean, I go to a lot of the school mental health meetings, team meetings, and it's just really, the deep dive, the work that they do with students and families is just amazing. It just really has helped close some of the gaps.
Yeah.
Well, thank you for what you're doing, because I think the stigma, particularly in communities of color around mental health,
Yes.
Prior to the pandemic, was a negative one, and now everyone seems to be in the same position with regard to trauma, and so I think it has helped to release some of the pressure of, I need just a little bit of help. So I think the work you're doing is great. Thank you so much.
Thanks.
Can I make one more comment?
Sure.
Don't roll your eyes at me. And I'm glad Board Member Moffitt mentioned that, because in my question, I meant to comment that because the district has hired more social workers, that some of that, what we call slack of kids not being able to be served by mental health services because they don't have Medicaid, has been picked up by some of the additional supports that the district budget picked up. But so I think that that's great, and happy that you all are still around and doing well, and look forward to some ongoing work with you.
Well, and you guys still set the bar, as far as I'm concerned, nationally around community learning centers. And it goes without saying, that in our teams at these, it's very different than any other school district where we have resource coordinators that are there on site, so that a lot of times when kids get access to mental health care, everyone's like, whew, they've got everything they need. No, they need all the other social emotional supports and, extra activities and things that are offered. And so the resource coordinator being right there and I've seen it time and time again, it's like, well, wait, they're not connected to such and such a club, or they're not connected to this, or we'll get them there. And so that's why it's very different than any other school district that I've seen. So thank you for the work that you do, and I look forward to continuing to work together.
Thank you so much. Up next, we will have, we're going to move on to, Mr. Glover. You're up next. Our legislative liaison. And Mr. Glover, if you could take probably about maybe 6 minutes or less.
I have narrowed down to 5.5. Is that okay?
Thank you so much.
Provided I don't say anything.
I welcome
Thank
your
you.
comments anytime. Good afternoon, ladies. Good afternoon, ladies. I am George Glover, and I, along with former State Senator Eric Kearney, provide the professional representation services in the Ohio General Assembly on behalf of the Cincinnati Public School District. We deal with not just the legislative issues that impact the CPS, but also some of the executive issues as well. You have before you our monthly report. I will focus my remarks as briefly as I can, and certainly be available to answer any questions or comments following my remarks. I will narrow them down by simply saying, first of all, the political arena, if you will, or the atmosphere in Columbus remains pretty much the same. As you probably know, or have read in the paper or heard in the media, there's a continuing drama surrounding the future of state legislative districts in the state of Ohio, both the Ohio House and both the Ohio Senate. It's gone through a juggernaut of political up and down with the Ohio Supreme Court. We're now, if you will, in a position where if no further action is taken by the appropriate commission in Columbus, then on May 28th, this coming Sunday, through a default, it will go back to a prior set of recommended state districts with Ohio Senate. So May 28th, this Sunday, is a key date, looking forward to see whether or not there will be a change in districts or going back to the second round of proposed districts several months ago. If that occurs, and my hunch is there's probably a pretty good likelihood that will occur, then we will see a special primary, not a special primary, but a primary in August and the second Tuesday in August to determine who will run in those districts with Ohio, as well as the respective Republican and Democratic state central committees. Those are the two bodies, if you will, that were not covered by the last primary. So stay tuned. We'll see what districts we have going forward. And that could impact some districts in Hamilton County as well, not just throughout the state of Ohio, but in Hamilton County. Secondly, you'll note in my report that there is now a new superintendent of public education, former State Board of Education Vice President Steve Dakin, finally selected by the State Board of Education. He does have extensive experience in Columbus, serving as the superintendent of Reynoldsburg High School, but also serving in the Department of Education, and also serving Columbus State Community College. So I bring that to your attention as well. And finally, in terms of legislation, when we talk about the current political environment in Columbus, we are in what we call the final session, if you will, before they go into their summer, or if you will, their election recess. They will be in session approximately 2 more weeks, perhaps 3 at the very most, in late May and early June. And much of that focus will be determined by what they call the state capital project budget, which is expected to be introduced and enacted by the second or first week in June. Again, the state legislative districts remain a hot political potato throughout Columbus as well. And any other legislation, and you will see a variety of bills we cover on your document for the month of May in front of you. Most of those bills are pretty much stand at ease, if you will, in the next 2 weeks as they rush to finish their business by about mid-June. Many of those bills are introduced just for, if you will, to get attention, if you will. Some of those actually are very much policy impacted, and we will continue to track those throughout the summer and the fall. When we talk about a legislative recess, we're really talking approximately June, July, August, September, and probably come back into October and November. Certainly they'll have the traditional lame duck session following the November general elections, where anything probably will happen. The one bill that I know all of you have seen and heard a lot about, it's attracted a lot of attention, and probably will continue to be, is House Bill 616. That bill is co-sponsored by one of our area state representatives, Gene Schmidt from Claremont County. And that segues into my final, if you will, point I would leave with each one of you. Eric and I collectively, and by the way, Eric regrets that he can't be here today. He did have a prior commitment in terms of his position and the responsibilities he performs on behalf of the Ohio Chamber of Commerce. The value that we bring to your table on behalf of CPS is our collection of relationships we have throughout not just Hamilton County, not just the city of Cincinnati, but throughout the entire Ohio General Assembly. And an example of what I'm talking about is I have had a long-term relationship with State Representative Gene Schmidt throughout her entire political career. If there's a need, an opportunity for us to sit down and talk to her about that bill, we can certainly provide that opportunity as we interface with other legislators as well. On that point, I would be remiss if I didn't point out to you something I'm sure most of you probably already know. We're fortunate enough to have 2 members of the Ohio House, 1 Democrat, 1 Republican from Hamilton County, who served as prior members of the Cincinnati Board of Education. So they bring a unique perspective and certainly a unique background experience to what they do in Columbus as well. That being State Representative Catherine Ingram and State Representative Bill Seitz. Bill, in addition to serving in the majority, serves in the number 3 ranking leadership position in the Ohio House, called the Ohio House Majority Leader, number 3, and he really has much control and quite a bit of input in what they call the policy decisions for the Ohio House. So again, we're uniquely qualified and uniquely situated to have a number of good relationships that we can reach out to, House and Senate, Democrat, Republican, liberal, conservative, you name it. That's what we bring to the table right here. A final point, when we talk about relationships and the impact it can have on CPS, of course, is school funding. State Senator Bill Blessing, who many of you have heard me talk about before, and many of you have had the opportunity to meet, is a key player in this process. He sits in the majority, he sits in the Senate Finance Committee, and he has been charged by the President of the Ohio Senate to really be the point person in the Ohio Senate on school funding. Any revisions or changes that will come forth in the Ohio General Assembly will probably come through State Senator Bill Blessing. He is keenly aware of CPS. He has been trying to be helpful as he can in the past. And he has said any time going forward that he would like to meet with the board or meet with the treasurer or meet with a specific committee, he's available to do that. Now, the next couple of weeks, he's going to be kind of busy as they wrap up business, but certainly during the summer and the fall, as decisions and discussions begun to evolve the future of school funding in Ohio, he will be a key player that we can reach out to and have that communication with. I'll stop there. I'll hit the pause button to see if you might have any questions or comments at this point.
Do we have any questions from other board members?
Thank you for the update. I think House Bill 616 is definitely the most recent, but we really do need to keep an eye on House Bill 327 as well. They kind of go hand in hand as far as being non-favorable towards us, and but we don't want to. One of them talks about libraries and government agencies that also would be restricted towards divisive concepts. Is that 327 or 616?
I believe it's 327.
I think so too. So I just want us to make sure that if any movement happens, just kind of give us the call so we can definitely move into action for sure on 327 and 616.
Dr. Buffett, I can assure you that the entire state of Ohio is focused on this legislation. If you have any interest in education at all, everybody's talking about this.
I guess.
I will also tell you that the House Bill 616 has been introduced and referred to a committee where it's had no further action at this point.
Okay. It's
So,
one of those attention bills that you said that they have, like a bill for attention. Did you say that? Never mind. Like one of those bills that just kind of gets attention and never mind. Good job, Mr. Glover.
You're correct. Oftentimes, bills are introduced to gain attention. But that doesn't necessarily mean they're going to be enacted either. Keeping in mind that you've got the Ohio Senate, the Ohio House of Representatives, but you also have the Ohio governor who has the final veto whether to sign a bill as well.
Thank you, Mr. Glover. If we don't have any other further questions, thank you so much for providing us with the very important updates and staying in tune with the different bills. Thank you.
My pleasure, and thank you very much as well.
All righty. Up next, we have an update.
Can I add one,
I'm sorry. Go
one
ahead.
very important point?
Yes.
In terms of reaching out to the new superintendent, I believe we're prepared to offer, if you think it's a good idea, once the session is over in Columbus, perhaps this summer or fall, to help organize a reception or breakfast or some event where we can introduce the new team to all members of the Hamilton County Legislative Delegation. We've done that before, and I think it's been very successful.
Yes, thank you so much. I think that would be a great idea.
Good. Thank you.
All righty, thank you. All right, up next we have an update on resource coordinators and also community learning centers.
Good afternoon, everyone. I am very happy to always speak about our community learning centers, in particular the work of the resource coordinators. You heard two of the presentations reference their ability to navigate our schools due to the resource coordinators. We did share a document, I have today with me Ms. Casey Fisher, our school community partnership manager, but last week we did share a document that outlines by school each of the lead agencies and each of the resource coordinators serving in those roles. And to date, there are 5 schools that do not have a lead agency. We feel very confident in being able to continue to support them in selecting that lead agency. And then there are 46 resource coordinators in our schools as of today. Just some background information. This community learning center model pretty much got started while we were going through our facilities master plan. And there was a tax levy we were not able to pass. We were having a hard time with passing. And so some of our board members, administration, and others came together to talk about how we could get connected a little bit more to the community so they could support what was happening in our schools for all of our children. We came up with this community learning center model where, as you know, we have health clinics, dental clinics, eye clinics, and as Susan Shelton shared earlier, mental health therapists in just about all of our buildings, -2, in order to support the needs of the students so that they can excel academically.
Thank you. That was very brief.
You asked me to be brief.
I did, and you did a great job.
Yes, ma'am.
Any further questions or comments?
I do. What schools don't have a lead agency?
So
You
there
said
are
that there were
5.
5, right? You said
Which
that there were
schools
5.
do not have a lead agency?
There's 5. Casey, can you help me?
The 5 Rising Star sites, I believe, Ezra Charles, Aiken, Vine, no, not Vine, I'm sorry. Yes, Vine, and I can't remember the fourth one. And then there's also John P. Parker in Kilgore.
And I think the only question that I had, what is the plan moving forward to make sure that those 5 schools are receiving or getting a resource coordinator?
So we recently launched an RFP process, and at this point, when we're open again to secure contracts, so sometime in early July, working with the schools throughout the summer and early fall.
And if I could add, all of those schools are actively interviewing with potential lead agencies.
Are they switching agencies, or some of them didn't have them at all?
They didn't have them.
All right. Thank you so much.
Can we get an update on that? So by August, they should have a lead agency, right?
Well, because of the RFP process that was put in place, they would, unless there are 3 schools that all have a different agency through the RFP process, we won't be able to post it again until the end of the school year.
I'm sorry, help me understand
So
the time.
prior to the RFP process, the schools could just reach out into the community, do their asset mapping, and engage interested agencies. Now, because of the RFP process, we're ensuring that we're meeting those federal requirements and compliance. And so the way that the purchasing department is working with me through the RFPs is that we have to have at least 3 organizations that are interested, that a school is interested in before they'll launch it again, because it's a public posting. But I can double check with them to see if there's any type of different revisions that can be put in place to do it earlier. But as right now, we launched it in January to go in effect for April.
So, I want you to just explain it to me like I'm 2.
Yes, ma'am.
So they potentially have the ability to start the school year without an agency?
Yes, ma'am.
And then they would go all the way until the next school year without an agency?
Yeah, so for this coming school year, it was posted and reviewed in April for the agencies to start for this coming school year. But since they're the only ones left,
Okay.
I can check with purchasing to see if we can move that up. But that's how we've been operating these last 2 school years.
Why did we go to an RFP process for them?
I was told that it was because of compliance, because of the funding source, that we have to publicly post it through the RFP process.